Welcome to the Amateur's Guide to Atherosclerosis, where we'll take you through everything there is to know about this disease. Atherosclerosis is the scientific term for the buildup of plaque in your arteries. This is made up of fat and other materials and can ultimately lead to a clot. Everybody experiences this to some degree, but the level of buildup increases with the presence of certain risk factors. These include smoking, drinking alcohol, a lack of physical activity, and an unhealthy diet. These are all infamous bad habits, and with good reason. They all contribute to increases in blood pressure, blood sugar levels, and cholesterol levels, which in turn can cause obesity and diabetes. These conditions are bad enough on their own, but also damage the endothelial cells that line the blood vessels. This becomes a foothold for the plaque to build up. As this occurs, the plaque thickens and hardens the normally elastic artery walls, making blood flow difficult. Over time, a complete block can form that halts blood flow. This is how a heart attack occurs. A fragment of plaque can also break loose and enter the bloodstream. If it goes to the brain, it can cause a stroke. In the body, this causes thrombosis, which leads to tissue damage and heart failure. Onset of atherosclerosis begins in youth, so prevention requires avoiding risk factors early. This can also reduce progression in patients that already have it. Methods include a healthy diet, exercise, and avoiding harmful chemicals. There are many ways to screen patients for atherosclerosis. One example is through a blood test. Patients with the disease show high cholesterol and blood sugar levels, which may be found through such a test. Another common method of identifying cardiovascular issues, such as atherosclerosis, is an electrocardiogram, or EKG. This test measures electrical activity in the heart and can find issues with rate and strength of the heart's beating. To actually see the plaque developing in patients with atherosclerosis, doctors can use imaging technologies. These include Doppler ultrasounds and MRI, and allow for a clear diagnosis. A number of treatment options are available for atherosclerosis, including both pharmaceutical and surgical interventions. ACE inhibitors and beta blockers are drugs that decrease blood pressure to lessen the stress on the diseased arteries, while statins lower cholesterol, which prevents plaque buildup. If the disease has progressed too far for drugs to be effective, surgery may be required. Endarterectomy involves actual removal of plaques, while bypasses can redirect blood around clogged arteries. In angioplasty, a balloon is used to widen an artery so that a mesh stent may be placed to prop it open for more blood flow. In addition to the physical harm done by atherosclerosis, mental health may also be affected. Risk factors such as poor diet and low physical activity can cause depression, while medical costs can cause patients a lot of stress. Thanks for watching. We hope you enjoyed the video.